The primary barrier to any perio case acceptance, actually, some of this, wouldn't you agree, is true for any acceptance, not just perio. But one, lack of education. When they come in, basically, what do they know? Generally, very little. My friends, fear and anxiety is still evident out there. 3/4 of the population in the world has a fear and anxiety of seeing us. Financial concerns, especially in the last 12 to 15 months with inflation. And you always hear this. Can you do it now? Time constraints. And then we have cultural and linguistic challenges. This is an inflammatory reaction to a stimulus. Now, this one happens to be zirconium, placed too close to the bone. But half of Americans have periodontitis. Probably 80 or 90% have gingivitis. But notice, this is a lot of people. And notice that about 9% have mild, 30% have moderate, and 9% have severe. Why do I show you this slide? Primarily because half of your patients need SRP. But most of your patients want what? A prophy. Now, if you create a bumper sticker that says floss or die, that's fear. But if you link their current medical conditions with what we know with science, then you have a better chance. And so what do I mean by that? You need to go through their medical history with a fine-tooth comb. Anything that is related to what you see on this screen is related to periodontitis. The more severe the periodontitis, the more they are at risk of any of these diseases becoming more serious. I didn't say create the disease, but make the disease more serious. Now, can you see how listening to a patient, telling them that you care about them, not just about their gums and their teeth, you care about them. So healthy mouth, healthy body. These are the questions we ask. These are the motivational interviewing questions we ask. This will take you 5 minutes. Who was your dentist in the past? What was the like? And we're writing it down so they can see that we're writing it down, whether it be on an iPad, on a legal, doesn't matter to me. Do you have any symptoms of gum disease? You see, we're waiting for them to say no, so that we can then move in the direction of a silent disease. Has any dentist ever mentioned gum disease? Probably not. When was your last cleaning? That helps us with risk. Anybody in your family, brothers, sisters, parents, have any history of gum disease? Why are they asking me that? Genetics. Do you use tobacco? Why are they asking me that? Because of the relationship of tobacco to perio. And do you grind or clench your teeth? Does your husband see a dentist? Well, if he doesn't, and he has gum disease to the level that you have, then we're not going to be able to control the microflora in your mouth because it is a transmissible disease. Stop talking, listen, and show them. Whether it be a hand mirror from Walmart or whether we move forward to a digital scanner, show them what's in their mouth. Show them where there's pus. Show them where there's a loose tooth. Show them where there's gingivitis. And once we do that, we begin to get ourselves into a staging and grading phenomena. And I hope you're using staging and grading at least to describe to the patient where they are with their disease, including their risk. I hope you're showing them their radiographs, showing them where the bone should be. It's their mouth, not some brochure, but showing them where the bone should be and where it is. If you're going to do periodontal charting, let's hope that you tell them beforehand what those numbers mean, so that while it's called co-discovery, while you're doing the exam, they're listening. It's time also now to start looking at this whole game of water flossing. Studies are now beginning to demonstrate that these types of devices are as effective as floss. The one that I am akin to, the one that I use, is the Sonicare Power Flosser. Being a periodontist, we are really hung up on science. And when I look at the data, the first thing you're going to say is, oh, no, are you kidding me? This thing can be as effective as dental floss or even more effective than dental floss? Yes. Yes, it can. The physics of creating this squad stream in the Power Flosser, unique cross-shaped nozzle, wide streams, thorough cleaning interproximally and along the gingival margin. And this is just one of the data sets. If you look here, MTB, manual toothbrushing, string floss, 2 weeks, green, the black is manual toothbrushing, Power Flosser. Look how significant the black is over the green by just the addition of the Power Flosser and not the string floss.